We spoke to your colleague Jane Brightman back in 2021, just before she joined NHS England, and her message was really, don't let social care get left behind when it comes to technology. Do you think that message has been heard in recent years by technology providers, by the government, and by others?
Yeah, I mean, it's been really interesting actually rereading that article because that was before Jane joined the team, and a lot of what she was saying was absolutely spot on in there, and I think full credit to her for that. I do think that that message has been heard. If you look at the People at the Heart of Care white paper that was published in December last year, possibly 2 years ago now, there was a whole section of that on technology, but crucially, it was also then wedded throughout the entire document. It's really changed the way in which people are viewing technology and social care. I think we're actually in a slightly unique position in social care as well, because it's relatively greenfield. So if you compare it to the health service, for example, which has a lot of legacy architecture, we've got huge opportunities to actually just skip a generation of technology and perhaps get ahead of the NHS in some areas. So short answer, yes, I do think that message has been heard, and I think there's a lot of investment that's being put in and a lot of positive changes that we're starting to see in the sector.
I suspect from what you're saying, there's lots of technologies that are being offered to social care from lots of different technology providers in all sorts of ways. What would be your advice to those technology providers in terms of the way they can sell into social care, the way they can offer their solutions to some of the problems that are being faced?
I think my advice would be, first of all, understand the sector and understand who it is that you're selling to. So this comes back to the point about actually understand where the benefits are going to lie. So if you are seeing, if your product is largely going to be improving health outcomes for the individual, if it's largely going to be cutting demand on the NHS services, then you may well want to approach the integrated care boards or the local hospital trusts and talk to them about whether they would be interested in commissioning or procuring product on behalf of the sector. If it's around improving productivity and efficiency, it might be the local authority that's appropriate, it might be the care provider that's appropriate. And if it's about improving quality of care and essentially market differentiation, then it may well be the care provider that you want to approach directly. So that's the first message, is understand what your benefits are and who it is you're actually trying to sell to. The second thing is that I think we are increasingly, I would expect, going to see individuals expecting more technology to be used in the provision of care. So not necessarily the care providers, but the care providers' customers and the families of those customers. I would expect that we will increasingly see people who are prior to needing social care starting to use technology as well to prevent future demand. And I would expect us to start to see, we already know a significant part of the social care purchasing in the country is conducted by private fee payers or family members doing third-party top-up to a local authority rate. So it's worth just remembering that the model is quite different in social care. So there may well be individual purchases rather than organisational purchases that should be considered for a lot of this stuff. So one of the, again, taking my grandmother as an example, she was a private fee payer. We as a family had some of the technology that's available even now being available to her 10 years ago when she first had a stroke. We would have put some of that technology in and it would have given us a lot more confidence as a family. She wouldn't technically have needed it from a social care perspective, but it would have meant, because we all live remotely from her, that we had confidence that she hadn't fallen, for example. As she got older, the technology that would have been helpful at that point started to become available, but would have been too complicated for her to then use as she got more confused as she got older. So there's that real, I guess my message to the suppliers would be, make sure that you know who your customers are, but also don't forget that you may well be looking at an individual consumer market rather than selling to provider organisations, and they are one of your key customer groups, particularly because if in future I would expect those individual customers to start being the drivers for demand for your organisational purchases.